my plea to the people of Illinois is hang in there. This is going to end. It will get better. We need everyone's cooperation to do that, and we will get back to the normality that we all crave.
Just got some new numbers from the state of Illinois. We're at 60,389 cases this week, less than half as many as were reported last week. We're at 2.9 million cases overall. The test positivity rate right now is 5.8%. That's down from 8% the week before. So we're trending downward. We're really trending well here. First of all, let me just ask you this. How does that look compared to what you see nationally? I mean, is Illinois doing well?
Illinois is actually doing well. If you're looking at the overall net pattern of the country, it has reached the peak that we've seen with Omicron and starting to come down in a decremental way. The upper Northeast and the Midwest, represented by Chicago and Illinois, are doing better in general than the rest of the country. The southern states and the states in the West have either not yet peaked or are peaking and starting to come down. But right from the very beginning, when we saw the initial peak in that rather sharp surge, the downturn was represented around the New York, Boston, Philadelphia, upper Northeast corridor, as well as the upper Midwest. And Chicago is a pretty good representation of that. Bottom line, you're doing well, but we've got to keep it up. I think one of the things we have to be careful of is that we don't get overconfident, and just because things are turning around, we lift up our guard a little bit too soon. Because we're doing well, we want to keep going in that downward trajectory, hopefully to get us to a low enough level where we can actually start to return to some sort of gradual normality. That's what we're all looking for.
Well, and I wanted to ask you that because in Illinois, we peaked at 44,000 daily cases on the 6th of January. And that's been dropping from 44,000. On February 2nd, we were at 9,000. February 10th, 10,000. It ticked back up a few hundred. But I mean, that is an astonishing decrease in a very brief period of time. I mean, it looks like a very steep downward graph. To a lot of Illinoisans, that's great news. It looks like we're coming out.
Well, to the Illinoisans who feel that way, you are correct. But also, Illinois has been through multiple surges the way we all have. And that's the reason why I want to say it's encouraging, and I feel good about it. But we've got to make sure we don't get overconfident about this and have our mitigation methodologies and the things we're doing continue to be prudent and careful. We want to get away from strict kind of restrictions and things like that. But the way you do that is by gradually getting us down to a point that's much, much more compatible with the way we want to be. The good news, as I mentioned, is that Chicago as a city and Illinois as a state is actually clearly going in the right direction.
Dr. Fauci, I want to ask you about vaccinations. We have a pretty good vaccination rate here. 70.7% of Illinoisans, this is as of today, 70.7% of Illinoisans fully vaccinated, 80.4% with at least one dose. Nationally, how does that compare? Are we doing okay?
It's as good as or better. As good as or better, no doubt about that. We have about 63%, 64% of the entire population is fully vaccinated, and just shy of 70% of adults are fully vaccinated. And the elderly have done well. We have, greater than 85% of the elderly are all fully vaccinated. 90% or more have at least one dose. One of the things we really want to emphasize, and I take this opportunity to give the message to the people of Illinois, is that we have clearly seen now that the booster shot, either the third shot of an mRNA or the second shot of a J&J, is playing a major role in reconstituting and providing good protection against Omicron. And so we want to make sure that people who've made the right choice in getting vaccinated should go ahead and make sure they get boosted, because we're not doing as well with boosters as we're doing with vaccination. We only have a little bit less than 50% of the population who've been vaccinated and who are eligible for a boost. We've only had about 50% of them who are actually boosted, maybe a little bit less than 50%. We really want to get that way up into the 70 and 80 and plus percent, because no doubt that boosters play a major role in protecting you.
Dr. Fauci, I want to ask you about masks in two different ways. There is an indoor mask mandate for all public settings in Illinois right now, for congregate settings, for restaurants, for everyone. First of all, how much longer do you think we're going to need to do that?
You know, it's very difficult to predict. The restrictions and the mandates, particularly things like indoor mask mandating, not only in Chicago and in the state of Illinois, but all over the country, will really depend upon this decrement that we're all seeing in the number of cases, and particularly the amount of hospitalizations and deaths that we're seeing, because we want to make sure that we are able to handle, from a hospitalization standpoint, the load of individuals who are significantly ill. Fortunately, we've been able to do that. It really would be folly to predict when, and it's going to vary, I believe, from region to region of the country, because some regions, some states, some cities are going to do better or worse than others. So when you get to a point where the dynamics of the virus clearly are at a much lower level, and the level of transmission is really considerably lower than it's been, I believe you're going to start seeing a pulling back on many of the mandates, including indoor mandates for masking in congregate settings.
I know you hate to be pinned down, and you always think you're going to get misquoted, which you have been, so I understand why you feel that way, but can you give us a ballpark?
No. I'm sorry, I can't. I think it just has to relate to look at the numbers. When you're going in the right direction, my plea to the people of Illinois is hang in there. This is going to end. It will get better. We need everyone's cooperation to do that, and we will get back to the normality that we all crave. But just hang in there with us.
Now, I told you I was going to ask you about masks in two different ways. Okay. The other question is about school children. Illinois, like most other places, is having school children wear masks. I have a 10-year-old. She's in the 5th grade. She's frankly, to her, it's no big deal. Okay? She just thinks it's something kids do. But a lot of parents are looking forward to when their kids don't have to do that anymore. What are your thoughts on children, first of all, needing to wear masks at school? And what do you think about the possibility we're going to be able to lift it?
Well, certainly there will come a time, hopefully rather than later, when we will be able to lift the mask mandate in general, including to schools, but we're not there yet. You know, we know now we've been able to keep open over 97% of the schools in the United States. And the reason we've been able to do that is a comprehensive, layered plan of providing safety for our children. And that includes vaccinating teachers and personnel who are surrounding the children. You provide a safe environment for the children by surrounding them with people who themselves are protected. Number one. Number two, vaccinate as many of the children as you can. We still really, even though we can vaccinate 5-year-olds and older, we have approval for that. Nonetheless, there has not been as much uptake as we would like to see. So we encourage parents to vaccinate the children. Next, you provide an environment in the school, hopefully with things like good ventilation, but also masking. When you put all of those things together, the school system has been really quite safe for children, with few exceptions. We haven't seen the kind of transmissions and outbreaks that we were concerned about. So before we start talking about pulling back on them, let's get that dynamic of the virus in the community low enough so that we can feel safe in pulling back on the requirement for children to wear masks.
I think I only have time to ask you one more question here, maybe, and that is, I want to ask you about right now in Chicago, everyone that comes into a restaurant, dines indoors, goes to a gym, they have to present proof of vaccination. First of all, do you like that? Proof of vaccination in public settings, and do you think it needs to continue?
Well, each individual jurisdiction, in this case, Chicago, has made that determination. I believe that is one of the important ways to keep the indoor environment safe. So when the authorities in Chicago make that decision, I support it. It's going to be different from different places throughout the country, different cities, different states, different regions. But anything that we can do during this very difficult situation that we find ourselves in right now that could diminish the transmissibility, I'm in favor of it. No one likes, and I certainly don't, even though it often gets taken out of context with me, I would prefer not to have to mandate things to people. I would hope that they would voluntarily do that. But sometimes requirements like you are referring to really do help preserve the public health. And in that regard, and to that extent, I'm in favor of it.
Well, quickly, the public health commissioner said just a couple of days ago, they think we're close to rescinding the vaccine mandate proof order,
right,
where you have to show a card or show it on your phone when you walk in a restaurant. Would your advice to her be don't do that yet?
No. Are you talking about Dr. Allison Arwadi?
I am.
A good friend. Actually, no. I mean, she has extraordinarily good judgment, and I talk to her very frequently. And if she makes that decision, I have total confidence that that's the right decision. She really knows what she's doing.
Last question, Dr. Fauci. I'm going to pin you down. Now, it's baseball season pretty soon. Cub fans, Sox fans are going to be at Guaranteed Rate Field and at Wrigley Field. I know you have other baseball allegiances. But what do you think? Are people going to be showing up at the ballpark? Are they going to have to worry about masks? Or do you think that by then, by baseball season, will masks be a thing that we don't have to worry about?
Again, I'm not going to give you, you're trying to back me into that mask situation. You're doing a good job. Congratulations. But I look forward to the beginning of the baseball season, whether you're wearing a mask or not. One of the great pastimes in America. I'm looking forward to it. I will be at the baseball field here in Washington, D.C., watching my beloved Nats, who didn't do too well last year, but nonetheless, I'll still be watching them.
You do remember I'm sitting in a town with the Cubs and the White Sox.
I know that.
The team's not doing very well. We're right there with you.
Right.
Doctor, thank you. Any last words you want to give to the people of Chicago or Illinois?
No, except you guys are doing, and ladies are doing a really good job. Just keep it up. We're going in the right direction. Just keep it up and hang in there.